You ready? Alright, this is a video on how to show you how to use this knee immobilizer. We would use this if someone had a knee injury that was pretty significant and we were wanting to send them to the doctor, an orthopedic doctor, or maybe the emergency room to get it looked at, get an x-ray, get maybe an MRI to see what's going on inside the knee with soft tissue structures. So this is pretty handy for that. An athlete may also be in this type of immobilizer after they've had a surgery, and they would be in this for a little while just to make sure that they can't move their knee. We don't want any kind of flexion after an injury, and we want them to have it completely straightened out into extension and supported and braced so that we can't make anything any worse until we know what's going on with it. Okay, so this one is really nice because it has some adjustments here on the back. So if you need to make an adjustment in the length, you just push down on that blue tab and then you can slide it this way or this way. So I've got it set on medium on both ends. Okay, if you play around with this, you can figure out how to adjust it really easy. There's also this big metal stay on the back, and that's really what's going to keep them from being able to do the flexion movement at that hinge joint of the knee. So you have to make sure that this is on the posterior side, so on the back side of the knee. If you happen to do this wrong and put it on the anterior, it's going to be extremely uncomfortable and you're not going to be able to get it fit the right way. So the other thing you need to notice about this is one end is larger than the other. The larger end goes on the thigh, the smaller end goes on the lower leg. Okay, so if you play around with this a little bit, you won't have any trouble with it. It's just you have to get familiar with it. So you're going to undo all the straps. It's Velcroed as well. And again, I've already adjusted it where I think she's going to be at a medium. Okay, now, if they actually have an injury, you're going to have to be a little bit more delicate with moving their leg around because, again, they're going to have a significant knee injury. Okay, so you may have to have some help with lifting the leg up, giving support on the leg when you lift it, someone else sliding this under. You want this little crease right here to be pretty close to the midline of the knee. Okay, the top end of this should go up into the groin area. It really doesn't matter how far down this piece goes. Okay, so this goes down first, and then the Velcro. You want it to be relatively tight. And again, this is going to Velcro, so it's in a good position right here. I can feel her patella through this opening. Now we've got to do all of our straps. We'll just start at the top and work our way down. Some of them will have a little ring that you have to run it through. So they just kind of crisscross back and forth. You'll have two above and two below the knee. When you get done, it's very well supported. It's in a good spot, and I can't put her into any more knee flexion than that right there. So it's very stable and supportive, and now she can either go to the orthopedic doctor and get it looked at, or if she's already been to the orthopedic and had surgery, now she'll be in this for a few weeks depending on what the surgery was. And that's it for the knee immobilizer.